Hey guys, today we are going to discuss the OET letter writing for physiotherapy. So we are taking the sample test 1 from the official OET site. For example, okay. So when you got that OET letter case note, what are the details you need to select? That's what we are discussing, and we are discussing how to write the letter too. Fine. So you know that this is that OET letter, and we can read from first onwards. Before that, we need to read the writing task. What is a writing task? From the writing task only, we can find our purpose, for what purpose we are writing the letter. So here it is given that using the information in the case note, write a letter back to the referring doctor detailing your findings and suggested treatment plan. So address of the letter is given, Dr. William Stacy, Grave Wall Clinic, 23 Station Road, Grave Walls. It is given, address is given. So what is the purpose of the letter? Nothing but we need to write the current health status of the patient and your findings and what the treatment plan you have suggested for the patient. That is the purpose of writing this letter. So we know the purpose, and what are the other supporting points for this purpose? Points which are supporting for this purpose that we need to find out. For that, we can read the case note from the first onward. And today's date, they are given the today's date 1st May 2018, and you are a physiotherapist in the private practice. Max Wolf has been referred to you by his doctor, Dr. William Stacy, for review and a treatment plan after presenting with chronic back pain. So Mr. Wolf visited you yesterday. So yesterday is a patient is visited to you, and the patient having chronic back pain, that is a presenting complaint. And when it comes to the patient details, name is given, Mr. Max Wolf, 35-year-old. Profession is a full-time musician, orchestral double bass player, lives with spouse, also a musician, no dependents. So, patient profession and the details regarding these details, it's not relevant for this case because we are writing back to the same doctor who is referred the patient. So we don't need to repeat the point again. So we can skip the professional detail and we can write this orchestral double bass player because it's semi-relevant because of that professionally patient have this complaint. Okay, we can include that. And back to this physiotherapy notes from initial consultation on 30 April 2018. So initial consultation, patient came to the clinic on 30. From the 30 till today, what happened to the patient? All this detail we are writing. Then, so it is given that today date is May 1st, and initial consultation date was 30 April 2018. Now, family history. As I mentioned regarding the profession, same thing. Regarding the family history, we don't need to include in this letter because all the family history, patient history, everything is known to the doctor. So we don't need to repeat again. And from subjective details and the physical examination findings are very important for this letter. So in the subjective detail, what are the details we need to select? We can read, first of all, we can read the subjective details, what they are written here. Patient complains of ongoing upper back pain, feels stiff, frozen, locked between shoulders. Also dull pain in lumbar region. That is a presenting complaint for this patient. Patient is reported to the physiotherapist. Okay, having the back pain and frozen, locked between the shoulders and lumbar pain in region. This complaint were aggravating when patient is having the prolonged performance on instruments. It's more than 2 hours, and getting ease by taking rest, it's also important. Symptoms developing over last 6 to 10 months, it's semi-relevant. You can include or you can skip it. Patient too busy at work to attend doctors, has been using non-prescription analgesics lately for relief. See, it's very important that patient is using non-prescription. Even GP also not prescribe the analgesics. It's self-prescribed medicine patient is taking to get a better sleep, especially after the evening performance. That also we can include. Bar splaying require particular body posture, that is patient normally sits on high stool with the body weight mainly on right leg, left arm is bent, rise up to near patient's ear on instrument, right arm reaches forward to produce sound with bow and balanced posture. So all these things are not relevant because that GP already know that what the profession patient is dealing with. No need to, so he already know that patient having this unbalanced posture, so no need to include this much detail. And patient concerned that current symptoms may prevent participation in important international tour, so that is a concern, that's what patient is visited to the physiotherapy. So also aware, however, of need to find and treat cause of current symptom to maintain long-term health and continue capacity to perform. So only these things only we can include from the subjective details. And from the physical examination finding. Physical examination finding, what, like in the clinic, in the physiotherapy clinic, what the physiotherapy has physiotherapist uh, as find what the physiotherapist identified from the patient side. Okay, so in that standing posture, mild thoracic kyphosis are there with the protraction of both scapula and forward head posture, and average build with the lax abdominal muscles, no need to write. So that posture we can mention. Flexion in standing, fingertips 10 centimeter below knees, mild scoliosis, convex on right scoliosis, because this kyphosis and scoliosis, uh, even through examination or not through examination, we can see, I mean, it's about the posture. Like when we are seeing the patient, it's through a bare eye we can see about the posture of the patient. So it is very important. And stiffness, we already mentioned, it's already the patient complaint having stiffness and locked in between the shoulders. No need to repeat it again. And side flexion in standing, fingertip to knee on left, complaints of right lumbar tightness, fingertip 5 centimeter above knee or right with the stiff segment T3 T8. See all these things, why we are skipping, because anyway we are not writing to the physiotherapist, we are writing to the GP, so a doctor, not a physiotherapist. So all this when you are writing to a physiotherapist, like same profession, you can include all this detail because it's relevant to them. But when it comes to a doctor, a normal doctor or a GP, family doctor, it's not relevant to them, because by knowing this detail they are not going, nothing relevant for them, they are not going to do anything with this detail. Okay, so just we are informing the findings, that's it. And in the palpation, increased tone, tenderness, left erector spinae T68. Yes, regarding the tone and tenderness, like related to the pain, all these things we can include it. So that's about the physical examination findings. Okay, then when it comes to the treatment plan, in the treatment plan, it's what treatment plan you done for this patient, that we are conveying to the reader. So posture training including cross steep and my mid thoracic spine to promote postural awareness and self correction of forward posture. Is it relevant in this? Is it relevant or not? I can say it's not relevant, because anyway the doctor is not going to assist the patient to do the cross steep to mild thoracic spine, all those things. Anyway, a physiotherapist only going to do, so we can skip that. We can only include that treatment you that posture training you done, and posture training you done, that we can write. And regarding the soft tissue release also we can write. Then mobilization, we can write, like spinal mobilization you are included started for this patient, you can write. Then regarding the home exercise also we can include it, because under home exercise no need to include that all these explanation, because as I mentioned the GP is not going to assist the patient for doing this exercise. Okay, we already trained the patient, that we can write in the letter. And regarding the review is very important, because doctor need to know that how many days patient have this review, when, what time, all these things that GP need to know. So we need to write review twice each week until the departure. And So until the departure, start of the concert tour, that we can write. Also, we have already introduced this strength exercise and self massage, and we can also include yeah, that's a self massage. Also, we can include that we are already mentioned here. So these are the points which is relevant from this letter, relevant points from this letter. With this relevant point, now we can write the letter.
Answer letter we will discuss in next video. If you like this video, please like, share and subscribe.